So, hi, my name is Dr. Caroline Taylor-Walker and I'm here at Ministry of Skin with Mel, and I'm just going to have a chat with Mel to try and help you find out a little bit more about the service that she offers here. Here at Ministry of Skin, we really like to look after people from their inside out. We see a lot of conditions on the skin, but we feel a lot of that is to do with inner health as well as just skin concerns as well. So we love to have a holistic approach, and we're only able to do that with Mel. So I'd like to introduce her to start with. So hi Mel, thanks for talking to me today. And what we'll do is we'll go over some questions so that we can understand a bit more what she can offer and how she can help you. So Mel, do you want to start off by telling me a little bit what functional nutrition is?
Yep, okay, so I'm a certified nutritionist, but I work on functional medicine principles. So that means I'm always trying to get to the root cause of what is going on for people, and I look at the systems of the body to try to balance out, and if I get those systems working well, then the symptoms disappear. I've also done extra training in functional diagnostic testing.
Yep.
So part of my treatment is doing a lot of the diagnostic testing to get to the root cause of what's going on and seeing what is going on with people's physiology.
Yeah, great. So it's all really objective.
Yeah.
How it's done.
Yeah.
How did you get into this area?
I've always been really passionate about nutrition. And I went to study naturopathy when I was 18, and Mum kind of turned me off it.
Really?
Yeah. So then I did an exercise science degree first, and I was in that industry for a while, and then did a bit of teaching as well. But I always came back to being really passionate about nutrition. And then I had my own fertility journey myself, and that's where I really started looking into how natural health and integrative healthcare could help people.
Yeah, great.
Yeah.
And then once you were free from Mum and could do what you wanted, you could then
Make my own decisions.
Yeah, that's fantastic. Yeah, that's really exciting. Do you specialise in any specific areas?
Yeah, I specialise in women's health. So anything to do with hormone imbalances, things like PCOS and endometriosis, infertility, perimenopause, menopause, I love treating. But because I work on those functional medicine principles where I'm looking at systems of the body, doesn't really matter what condition it is. I feel like I can help balance out all the systems.
Yeah. Sure. Because on my side, all systems are working together. You can't have one system functioning and another one not.
Yes.
It interacts with each other, which is, I think, why a lot of times we see such reactions on the skin when something's happening internally.
Yeah, we don't look at things in isolation, we look at things holistically.
Yeah, no, which is great. So how do you treat people if someone came in for a consultation with you? What's the kind of process of the treatment that you do?
Yeah, so initially we do a comprehensive case history, which can take up to an hour. So I look at their history, their symptoms, their environment, everything, and then we come up with a plan from that. So that plan could be going straight into treatment through nutrition and supplements, lifestyle modifications. A lot of the time I do further investigation with the functional tests I was just talking about to get more information about their physiology, what's going on internally, to get more data so I can really get specific about how to treat.
Yeah, great. And you mentioned functional tests. I think for a few people they might not understand what functional tests are. Do you mind kind of just explaining what they are?
Yeah. So it really helps us understand what is going on for systems of the body rather than just a point in time. So for example, I do a comprehensive hormone test called the Dutch test, and that tells us the level of the hormones but also the pathways that the hormones go down, so whether they're going down a preferred pathway or a toxic pathway. So we don't just get the end picture, we get the whole picture about what's going on to get to that end point. Yeah,
which is really important, because coming from a medical background, literally what we do is look at the three, say, hormones, estrogen, progesterone, testosterone, and if they're normal, then we say everything's normal. But what you've got to realise in the body is those hormones have to be made, and then they have to be at a level, and then
Yeah.
they've got to be broken down.
Yeah.
And we don't look at those in medicine, so sometimes for us the levels can be normal, but obviously if they're broken down incorrectly and you've got higher levels of a toxic one and lower levels of a beneficial one,
Yeah.
then that can be causing you those grey symptoms that maybe a normal doctor would just say go away with.
Yeah.
And so there's specific things that Mel can look into.
Absolutely. And similar to the thyroid test as well, we do an extensive thyroid test. So we look at the markers that GPs look at, but other markers to look at the pituitary function and further indicators where we can tell what's going on holistically with the thyroid.
Rather than just pinpointing, because like we said earlier, the whole system works as like a web and is interacting, whereas I think sometimes in medicine we're quite bad at just looking at one aspect and not putting the full picture together. And Mel also looks a lot of like the ingredients, like your vitamins and things in the body, because again in medicine we might look at the end picture, but we don't look at whether the ingredients are there to support that body. And at the moment it might be, our levels might be normal that we look at in medicine, but if the ingredients are fading, you'll be getting symptoms, and if we don't bring those ingredients in, you'll end up getting disease. So it's a lot of disease prevention as well.
And also my ranges are a bit smaller than what general GPs ranges are as well. So I have my optimal ranges, whereas GPs have their ranges that accommodate for sick people. With Mel mentioning about sick people, the lab results are averaged out by people who go to the lab, and those people who go to the lab are sick. So the averages are averages of people who are sick rather than people who are well. So even if you're at the middle of that average, that's for a sick person. Whereas you want to be like to the top of the range and healthy,
and be a nice warm, healthy person, not like a cold one.
Well, warm's a good indicator of health.
True. So that's really good. Now, I believe you offer some programs as well. Do you want to tell us a bit about some of the programs that you offer?
So I do 12-week programs. I've got a Stop the Hormonal Chaos program that I run, which is a 12-week program, and that includes 6 consults with myself. And then there's options whether to do functional testing or not. I also run a fertility program as well. That's also 12 weeks, and that's starts with preconception, helps with egg quality, and helps improve fertility for the male and the female. And then I'm looking at doing a gut program as well.
Yeah, great. They all sound fantastic, especially the gut one on my side about skin, because I find a lot of skin issues are from the gut, especially if we're struggling with people with things like acne or rosacea, that often it's a gut kind of issue, and hormonal actually, really, a lot of the time.
So they're the 2 things I look at if you're referring clients to me, because of skin conditions. I'll always look at their gut health, and then or any hormonal imbalances as well. Along those lines, which you might have just answered, so say if you have answered, but patients coming to kind of Ministry of Skin, what kind of things can you offer for them? I think it's looking at their internal health. So, I mean, we're doing great things with external skincare here, and that works a lot of the time, but sometimes I can dig a little bit deeper if there's resistance to some skin issues, and see if there's any imbalances going on, and then correct those imbalances, and then that's reflected in the skin.
Which is great, which is what we want to offer, because like we said, we see a lot of people with the skin concerns, and I'm definitely a big believer that there's internal issues that are happening, but even just in regards to age as well, because we see a lot of older people with skin changes in the skin becoming thinner, more wrinkly and drier, and a lot of that to do is hormones. Like the estrogen levels, menopausal times, and thyroid and things as well. And you might not be sick and ill with those issues, but they could be giving you like the brain fog, the tiredness, the not sleeping well, maybe mood changes, which are all things that Mel would look at. And the great thing as us both working here is that we work a lot together. So once Mel sees someone, if she feels there's more issues, I can become involved, or I'll do certain bloods and you'll do some functional testing, and in the background we're working on those together, which is great for both of us.
And I'm finding patients are loving that they don't have to go somewhere different to get a blood test from somebody else. It's all in-house and we're communicating constantly. So yeah,
That's
the
how it
patient.
should be. It's weird that it's not.
Yeah.
It frustrates us
I know,
both that it's not
I
that
know.
way normally.
Yeah.
Yeah, which is great. All right, that's been really interesting. Anything else you wanted to add or let anyone know?
I don't think so. I think we've covered everything. There's a lot of, I've just mentioned a couple of functional tests that I do, but there's over 200 that we have access to. So yeah, no, just I think we covered everything.
Yeah, great. Well, yeah, thanks, Mel. It's been great talking to Mel. Mel's working here at the clinic on alternate Saturdays at the moment, but that's definitely something that we'll hope to kind of increase over time, because it's fantastic having her here, and we really want to work on people's skin journey and their health journey in general in that holistic way. So if you wanted to see Mel, don't hesitate to give the clinic a call or book online or contact Mel herself.
Awesome.
Excellent.
Great.
All right. Thank you for listening.